Good morning, ladies. I would like to clarify something that's extremely important and that we have addressed in the women's health presentation, but this is separate in the sense that I want to take a amount of time to tell you the difference between bioidentical hormones and synthetic hormones, which are made by drug manufacturers. The bioidentical are made by compounding pharmacies. The synthetic are made by giant pharmaceutical companies that either create a synthetic progestin. I want to make sure you understand the difference between synthetic progestin and progesterone, which your body makes and which we prescribe here in a bioidentical form. Okay, so bioidentical means exactly what it says. It means it is absolutely identical to the hormone you yourself make or made, or used to make in more quantity and don't anymore as you get older. And just like men fall off in their hormones, women fall off in their hormones. It's more pronounced with women because you go through the perimenopause and the menopausal period where you don't have a menstrual flow anymore than it is in men, where it's a little bit more subtle. But so everybody is familiar with perimenopause and menopause because every woman will go through that. And the prescription for that condition, if you're developing multiple symptoms, which most women do, is bioidentical hormones, which makes all the sense in the world. If I were a woman, I would want hormones in my body that I used to make. I wouldn't want something made up by a lab. This progestins, I call it Frankenstein progesterone. Okay, it looks a little bit like progesterone when you draw out the organic chemical model, but it is vastly different. And one of the things that absolutely boggles my mind is the inability, not of lay people, which is understandable, but reporters who should know better, and even worse, of course, is doctors, physicians, who can't seem to get it straight, which is something so obvious, the difference between bioidentical and synthetic. Another synthetic hormone, which the pharmaceutical companies make, is made from horse's urine. That makes no sense to me. Why would you give humans horse urine? Why don't you give them bioidentical estrogen? I mean, it just makes no sense. The only people it makes sense to, of course, are the drug companies, which can then patent it. So you can't patent bioidentical hormones, right? Now they are learning a little bit about adding stuff to the bioidentical, and then they can patent it. Why they didn't do that, decades ago and saved lots of women's lives, I don't know, except that reason. But they're doing it now, and I'm happy to see that. I don't really care where you get your bioidentical hormones. What I care about is if you need them, that you get them. Right? So bioidentical, exactly the same as your hormones that you make. Right? They're started with either soy, and they're converted into identical hormones that you used to make. And your body can't tell the difference, lab tests can't tell the difference, and guess what? They're really healthy, and they really help you. Whereas, guess what? The pharmaceutical hormones are dangerous. And in the Women's Health Initiative in 2002, where all this came from, all right, they already knew about it, by the way, before, but it really became apparent then that pharmaceutical hormones were dangerous. Right? There is one hormone in the world that causes an increase in breast cancer. One. It is not a bioidentical hormone. No bioidentical hormones cause an increase in breast cancer. If you find one study that tells me I'm wrong, please send it to me and ask your doctor the same thing. Okay? I'd like to know about it because I've been studying this for 15 years And Dr. Hertog, my mentor, #1 hormone guy in the world, has been studying for 3 generations. He's 3rd generation bioidentical physician from Belgium. And 70 years, there's never been a study that shows that any bioidentical hormone is dangerous or causes breast cancer. The one that causes breast cancer, progestins, okay? That is the one that I call Frankenstein progesterone. Don't take it, all right? Now, if you're a young woman and you need birth control pills, that's an issue, all right? I don't have any really great answers for you. Older women do not take progestins, Provera or Proprim or some of the others that are made out there. They're dangerous. They cause an increase in breast cancer. Also, do not take oral estrogens, period. Again, I sympathize with young girls needing birth control, but older women, no way, okay? Because they cause an increase in heart attack and stroke and blood clots in your legs, in your lungs, if you take them orally, because they get converted in the liver into clotting factors. Not good. We don't prescribe them here. We have only creams for estrogen, and we use Bi-S, which is estradiol and estriol, the 2 estrogens that you made the most of when you were younger. And those are wonderful, wonderful hormones. Do not cause an increase in disease, including breast cancer. No study has ever shown that if you use transdermal estrogens, that you have an increase in breast cancer. If you see the study, let me know, okay? But oral, not good, okay? As a matter of fact, almost all the bioidentical hormones have a slight reduction in breast cancer. So in summary, I want to emphasize that there is a huge difference between bioidentical hormones and synthetic pharmaceutical hormones for women, particularly estrogens and the progesterone, and even if you needed the DHEA and the testosterone. Now, most DHEA and testosterone actually is bioidentical, but the progesterone, the progestins, no, right? And the horse urine, no. Okay, so, but the bioidenticals, which are made from soy, and they are absolutely wonderful and extremely effective in reducing all the symptoms of perimenopause and menopause and being completely safe. The pharmaceutical hormones reduce some of the symptoms sometimes, but they increase lots of problems, more inflammation and more serious diseases like heart attack, stroke, and breast cancer. Avoid them if you can and go to bioidentical hormones. Every single doctor should know this. I hope now that you've listened that you do. If you have any further questions, please give me a call. Thank you.